Hi guys, today we are going to discuss about the test that we do for fingers. Okay, now first of all we are going to discuss about the ulnar nerve related tests. Okay, first one is book test. In that only you will learn about Froment's sign. You need to take a big book and if you need to ask the patient to hold this book between the thumb and the fingers like this, between the thumb and the fingers. Okay, if he is able to do like this as shown, then there is no problem. Means he is negative for both Froment's sign and the book test. If one of the thumb is flexed, as you can see here, my right thumb is flexed, it is called Froment's sign, and my left thumb is as usual, so there is no Froment's sign. Means in Froment's sign, adductor pollicis, what adductor pollicis is injured or damaged. So if the person is showing Froment's sign, means then the adductor pollicis is damaged and its function is replaced by the flexor pollicis. Okay, my left adductor pollicis is functional because you can see no Froment's sign is there in left finger. Okay, now we are moving for the second test, that is a card test. For it you need a card. Here is my card. So this test is done for checking whether the palmar interosseae are functional or not. We need to ask the patient to hold the paper between these two fingers, and we need to pull it. If we feel that there is resistance, then we can say that palmar interosseae are functional and abduction is carried as usually. You can see here also I am able to hold this paper. Okay, this is card test. Now what is Gauss test? It is also done for the ulnar. Now Gauss test is nothing but you need to ask the patient to keep the palm like this on the bench, and if he is able to do oscillations with his middle finger, then there is no Gauss test, he is okay. But if he is unable to do this, then definitely it is positive for a Gauss test, and now that is injured is ulnar nerve. Okay, now we are moving for the median nerve. Okay, in median nerve also there are 4 tests to check whether the median nerve is functional or not. First one is ape thumb test. Ape thumb test is nothing but you need to see whether the thenar eminence is not present or not. Just elevation is there. Okay, right here elevation is there, just we need elevation. If this is not there, then we can say that median nerve is not functional. This is ape thumb. Okay, if it is flat, totally flat, okay, here the thenar eminence is injured or damaged. Now the second one is pen test. This is also test for the median now. So we need to keep the pen like this, and we should ask the patient to touch the pen with the tip of the thumb. If he is able to touch the pen with the tip of the thumb, then he is okay. If not, he is positive for pen test. And here the muscles that are damaged are abductor pollicis brevis. Okay, now the second test is pin grip test. Pin grip test is nothing but okay sign. If he is able to keep okay sign, then okay, otherwise he is positive. Okay sign means the patient must if the patient can approximate the tips of the thumb and the index, then he is well, there is no any problem, there is nothing. Okay, if the patient do the approximation of the finger pads of the thumb and the index, then there is a problem, and here we can say that pin grip test is positive, and the flexor digitorum profundus and flexor pollicis longus are damaged. Okay, these two are damaged. The anterior interosseous nerve innervates both of these. Okay, now by this we completed the pin grip test. Now we are going to discuss about the pointing index finger test. Okay, the pointing index finger is also for the median now. Here if we need to ask the patient to make fist, if he makes, then okay, if he not, then he is positive for this. Means while making, if his or her index finger is pointed like this, means it is not involved in making fist, then we can say that he is positive for pointing index finger test. and here the muscles involved, the muscles damaged are flexor digitorum superficialis and the lateral half of the flexor digitorum profundus. Okay, these are the muscles damaged. One is anterior superficialis and half of the profundus muscle of flexor digitorum. Now we are going to discuss about the radial nerve injuries. In radial nerve, there is only two tests. One is a wrist and finger drop. Here all extensors of forearm, wrist and dorsal side of the palm all get injured. Okay, it is called a wrist drop. Okay, and if there is one, this is also this is there means the patient is with injured radial nerve. And second one is thumb and finger drop, means there is no wrist drop but thumb and finger drop are there. You can see my wrist is normal but these fingers and the thumb is drop. So here the extensors of the fingers are injured. Here also we can say that the radial nerve is damaged. Okay, this is all about the injuries related to the hand. Hope you understood. If not, you need to read again. Okay, bye.